Alright, this is Chapter 2 of HED 250, and I am Dr. Purvis again. So we're going to go into Chapter 2, and for those of you who maybe have already read Chapter 2, which by the way I do recommend that you read Chapter 2, or you read your chapters prior to listening to the lecture, if at all possible. If you've read it, you may say, like, this is a really boring chapter. And I'm not going to lie, this is not my favorite chapter in the book. But I'm going to kind of give you some points on what I want you to know and what I want you to just kind of read but not immerse yourself in. How's that? Okay. So, introduction. So, preparedness for community health emergencies are needed. What is global health? What does that mean? And how can, like, health educators kind of influence and health prevention, promotion, protection, literacy, maintenance, enhancement, and access to on a global basis. So those are kind of what we're going to talk about in Chapter 2. Okay, so global health. It's this worldwide cooperation, interaction across the national borders, and relationships beyond government. Okay, so this is not just government agencies working together. It really focuses on health initiatives that involve worldwide cooperation. It's also, the science. Global health is the science of protecting and improving the health of entire populations, communities, neighborhoods, and in individuals as well, through education, promotion of healthy lifestyles, and research for disease and injury prevention. Okay, so then globalization links our health more closely to one another more than ever. So globalization, thinking about things like people travel, people move all over the world. People don't just stay in one place. With access to travel, now we see people doing this more and more. So how does that impact our health? Just think about that. So global health achievements, these are things like healthcare equality, improved quality of life, accessibility, global public health, protecting and improving the health of a community. So how do you improve and protect the health of a community? Things like preventative medicine, health education, communicable disease control, sanitary measures, and then monitoring environmental hazards. So doing all of those things kind of together can really focus on that global health, public health. So doing that, and not doing it just within one community, but looking at it and how all over the world different people work together to do these things. Okay. So what are the areas of global health? So you have environmental, biostatistics, behavioral science, health education, epidemiology, health service administration and management, maternal and child health, nutrition, international global health, public health laboratory practices, public health, and health education practices. So you'll notice that a number of these are actually specific courses that you will also take within your program. You will take a global health course, you'll take an environmental, a biostatistics, behavioral science, which is your theories class, epidemiology is a course, maternal child health is an elective, nutrition is an elective, and this is kind of your public health and health education practices course. So, these are things that we do focus on within our program. So, looking at overview of the evolution of medicine, health, and epidemiology. So let's talk first about lifestyle. Lifestyle, the most important health determinants for humans in history are things like practices, environment, and your actual survival. So lifestyle, thinking through what is lifestyle? Lifestyle really, the main objective is to preserve life and prevent death. Okay, so your lifestyle, what you do, how you interact, what are those basic things in life? Your lifestyle. What is your overall goal in life? Your overall goal is to stay alive and prevent death. So maybe for those of us in America, like, that is not something we really think about. But if you were in a third world country and you were really, struggling to survive, that's something you would really focus on. Is your goal is just staying alive every day. So what are some factors that affect this? Adequate food. Okay, so kind of thinking through third world. Adequate food. A lot of these places lack adequate food. Sanitation, water, housing, okay, income, employment, education, and safety. We may not have as much money as we want. Maybe we don't have our job that we want. We don't have the exact degree we want. But for the most part in the U.S., we have adequate food, sanitation, water, and housing. And typically safety to a certain extent. We're not in a war zone. So when we think about it, I want you guys to think outside of yourself. I want you to think about some of these things worldwide. Again, global. So, okay, so what are some things that impact, lifestyle, population, movement, politics, war, technical developments related to health statuses of a country or region, okay? So these are all things that really can impact, life, lifestyle, health, all those things, okay? Civilizations developed, okay? So as civilizations developed and people began to live, closer together, more densely populated areas, there were new health concerns. Okay, so water distribution systems, sewage systems, ample supply of food and water, increased, you had more waterborne diseases especially. This is when epidemics started to occur. Infectious diseases could not be contained. So as people started living in communities, they lived in towns, that is when you started seeing a lot of these health issues that we kind of think of now really begin to occur. So medicine and epidemiology developed. So many contagious diseases were eradicated. Okay, so thinking back on what I just said, so as civilizations really started coming together, people living together and everything, in more densely populated areas, there was a need for medicine. And with the need for medicine came epidemiology, okay? And that really helped to eradicate a lot of diseases. So poverty is the greatest contributor to communicable diseases and lack of healthy societies in many parts of the world. Okay, make sure you know that. Okay, third world or developing countries still suffer from a number of infectious diseases. Okay, things that we in the U.S. don't worry about, that we don't even sometimes know about, are things that these third world countries really deal with on a daily basis. So poverty and malnutrition affect every country's health. Okay, so poverty and malnutrition. Now remember, malnutrition, okay, I want to point this out, is not just the lack of food. So a lot of Americans are malnourished. It does not mean that they don't have food. It does not mean they're starving. It simply means that they really are not eating what they need to eat. So let's talk about it a little bit more on the next slide. So poverty is caused by a lack of resources in medical care, insurance, and education. Malnutrition is related to poverty. Okay, poverty related to deaths due to preventable diseases, especially in young children and women. So we know in the U.S. fast food is a major issue. A lot of times when kids especially eat a lot of fast food, they're malnourished. They're not getting what they need. They're getting, a McDonald's cheeseburger with no vegetables. They're getting, maybe high fat diets, high sugar for kids especially. That can result in malnutrition. Okay, there are obese people who are malnourished because they don't get the right foods. So we think a lot of times of malnutrition as a third world issue, but it's important to note it's not just a third world issue. Okay, neither one of these, poverty and malnutrition, are not just third world issues. These are both alive and well in the U.S., unfortunately. Okay. Developed or industrialized countries. So the U.S. is considered a developed country. New diseases and strains emerge as chronic diseases. So remember, chronic diseases are caused by lifestyle and behavioral choices. Developed countries' health problems today, chronic and non-infectious diseases, including obesity, high blood pressure, coronary heart disease, and more, okay? So 2 criteria to look at when you're thinking about the health of a country: infant mortality rate and the size of the population. poverty, diseases that occur due to a lack of resources. So again, we talked a little bit about poverty. You know, poverty is not just not having money for food and maybe being malnourished, but it's also, you know, not having money and even sometimes access to care. Maybe you don't have medical facility around that you can get help. Even if it's a disease that's curable, then oftentimes people living in poverty still cannot obtain the care. Okay? So we're going to talk a little bit about the history. Okay, I'm going to go through these very quickly because it's all in your book, and I don't want you to stress over these. I want you to recognize them. I'll point out a few that are a little bit more important that I want you to definitely know, but I don't want you to stress over all the dates and everything. Okay, on page 40 and 41 of your textbook, it has a really good timeline. I'm sorry, it goes to 42 as well. And look through that. I don't mean memorize it, that would be crazy, but just look through it. So I want you to know that in the very earliest health practices, a lot of these were related to religion. Okay, people did things based on what their religious beliefs were as far as health. Ancient Egyptian medicine developed a systematic method of treating diseases. So they had their own method. So in Egypt, you know, we're talking 3,000 years ago. There was what they believe a disease similar to smallpox. Okay, so they look at this through the mummified bodies. Okay, so this person died in 1157 BC. So we're talking well over 3,000 years ago. So smallpox, know this, is continually known as the oldest disease. Okay, so you know, for the first 1,000 years AD, you know, realized that they started separating people with diseases from the healthy population. That's what they really started doing. They kind of, you know, put people over in their own communities even. Leprosy was a big one, that they kind of had leper colonies. That was a big one. And the first medical theories based on a scientific experiment were about 100 AD. So these have been a very long time that people have been trying to figure some of these things out. Okay. University medical schools first established in Europe. The bubonic plague epidemic in Europe was, you know, 1347. This was when the idea and the term quarantine came up. It first began being used. Quarantine actually means 40 days. It's an Italian word. So people were held for 40 days. Okay, the 1500s, you know, the first study of human anatomy came out. I'm not expecting you to know names, by the way. I take that back. I'm not expecting you to be able to say the names because I'm not going to even try. Recognize some of the names. You know, in the 1600s, they started looking at the difference between morbidity and mortality. We talked about that last week. So kind of, you know, these are concepts that you're learning about that are not new. That's what I really want you to understand. Okay, so the 1600s, they started putting together the probability of dying at a certain age and using quantitative methods to describe population vital statistics. So things like birth rates, mortality, death rates, all those things, infant mortality, all those things, they started collecting that data then. Bacteria was discovered in the 1600s. During the 1600s, England tried to stop the plague. And they tried to say that all the ships had to wait at the river for 40 days to prevent the spread of the plague. But this attempt really failed, and the plague really devastated England until 1666. Okay. So in the 1700s, the U.S. Public Health Services started. Okay. Smallpox was in Russia and France and Sweden. Dr. Jenner, that is a name I definitely want you to know, came up with the smallpox vaccination, and that was huge. It saved thousands and millions probably of lives. Okay. In 1847, this is another name, man, you know, had created the mandatory hygiene instructions for schools. So this was the first time that there was actually like a hand washing, kind of the basic hand washing policies things like that. So that was 1837. John Snow is a big name. Cholera. When you think John Snow, think about cholera. He figured out cholera. The germ theory, those you've had like biology and everything's probably studied. 1851, typhoid fever, they figured out, in the 1800s, it was a person-to-person transmission. And then in the 1800s was when Congress, for the first time, appropriated funds to investigate the origin and causes of diseases. So this was the first time they really started looking up, trying to figure out what the heck is going on, basically. All right, Freud, this is mental illnesses, started looking at them. So, we've, up to this point, it's really been physical diseases, physiological, but now we're starting to look at mental illnesses, okay? Major Walter Reed said that yellow fever was carried by mosquitoes. Early 1900s, there were 38 states in the U.S. that had established state health departments. So no, now, it's all of them, but it started out as 38. The Pure Food and Drug Act of 1906 was passed. This is kind of the first Food and Drug Administration. Okay. So in 1918, the term health education actually started to come about. So in the big scheme of things, it's a newer term. It's just over 100 years old, or I guess it's right at 100 years old. Penicillin, which was huge, was discovered in 1928. This is, in the 1920s, 1930s is really when they started looking at student health needs and interest in designing curriculum. So started having, health classes in the schools. And remember, at this time, a lot of the schools were one-room schoolhouses. And so a lot of the kids were, even learning some of these things like together. They learned them on different age ranges. It depended on the location. Of course, we had schools just like we have today. At this time, but a lot of it was, more ages together in a combined environment versus how it is now. CDC, which started out as a communicable disease center, was established. It switched names in 1970. It continued to switch names, as you see. The World Health Organization was created in 1946. And the polio vaccine. Polio vaccine was another big vaccine. Probably most of you have had a polio vaccine. Y'all actually haven't because you're too young, most of you. But polio vaccines, it's been eradicated for the most part due to the vaccine. But a lot of people have had the polio vaccine, which was from the 1950s. In 1962, they really started looking even more at the needs of the students and how they were understanding health. And they put together the comprehensive school health education curriculum. Medicare and Medicaid, established in 1965. Okay, make sure you know the difference between Medicare and Medicaid. Medicare is assisting the elderly. Medicaid are those that are economically deprived. Okay, so that's your lower socioeconomic. Those living in poverty closer. They're not necessarily completely in poverty. There's a scale. But Medicaid is, it doesn't matter your age. Medicare is dependent on age. The NIH was established, which was huge. National Institute of Health. They really focus on research and how we're going to prevent a lot of these diseases. In the 1960s, smallpox immunizations really increased, okay, and smallpox really decreased in how many deaths, okay? So you're talking, 10 to 15 million cases and 3 million deaths. This was a big decrease, okay? I know those are huge numbers, but it was a huge decrease. In the 70s is when they started focusing on health education, saying, like, we actually need to make this part of the CDC. The WHO, World Health Organization, held a conference. And this is, again, like 1970s. The reason I point a lot of these things out is I want you guys to understand that a lot of what you're doing and what you're going to school to be is relatively new. and it's taken a lot of steps to get where we are, and the support is there, and that's important for you to realize. Again, the 70s, 1978, really focusing on these practices and the conferences. The healthy people and health objectives of the nation, these were important. You'll see these throughout your program. These are 1979. They're really working still to eradicate smallpox at this time. National Commission of Health Education Credentialing, this is NCHEC, which you heard a little bit about last week, was established in 1988. The CHES exam, which our master's students all take, 1990. Credentialing really started becoming a thing for health educators. The National Center for Human Genome Research announced the start of framework map of human genome. So genome mapping really started in the 90s. Continuing Department of Labor recognized health education as a occupation in 1997. 2000 began looking at the nasal spray for the flu vaccine. Oh, I told you that again. Okay. Health disparities, we're in the 2000s, so health disparities are still present. Safe drinking water and hygiene remain huge challenges in developing countries. Remember last year we saw safe drinking water issues in Michigan. So these are not just third world issues. There are things that happen in the U.S. Potential bioterrorist threat causing major health concerns in many countries. So bioterrorism is a new threat that hasn't been around prior really to the 2000s. The WHO reported chemical agent concerns, that these are a huge fear of the 21st century, and that they could undo, some of the biggest achievements that we had in the 21st century. Natural disasters such as hurricanes, we just had a huge hurricane not long ago, and other earthquakes and health events such as the swine flu and war are also major concerns moving forward in public health. This table is in your textbook. It is on page 55 and 56. Just take a look and realize, when you're looking at countries, some of these, the life expectancy is 46 years old, 39 years. Greece has one of the highest, if not the highest. This table may be it's 2007, so it's a little bit old. So it's got about, the average life expectancy is 85. The U.S., take a look, it's about 79. Sorry about that. 79. So, we're not at the top, but we're definitely not at the bottom. Okay. So what have been some of the greatest public health achievements? So the World Health Organization, which is WHO, cites 3 sources as the greatest contributions in public health. The plague and quarantine, so we talked about that a little bit earlier. Cholera and sanitation, so that was John Snow. And smallpox and immunizations. So smallpox was one of the first really big immunizations that, through immunizations, vaccines, pretty much was eradicated. That's a big thing. So, others also say the introduction of the pap smear in the 1940s was huge, and development of coronary angiograph was also a very big step. Okay. The World Health Assembly resolution, okay, this is really just saying WHO, encourages strengthening surveillance systems, emergency preparation. So, those are some of your disaster things. That's like your bioterrorism. And responses for the release of chemical and biological agents. So that's one of the biggest things that the World Health Organization feels that we need to focus on is kind of this international preparedness for chemical emergencies. So there's not really a specific one right now that all countries are really agreeing on, the developed countries, and that's something that is a big focus. Okay. So the CDC in 1999 named the 10 greatest public health achievements of the 20th century, so during the 1900s. Vaccinations, motor vehicle safety, so thinking through that one, heck, my parents grew up without seatbelts, car seat safety, right? Those are huge things that have improved so much. They just, recently said that kids need to be facing, rear facing even longer than previously. So that's another thing. It's something that's always evolving. We're continuing to work on safer workplaces, control of infectious disease decline. So, you want to control the infectious diseases. You're not necessarily going to be able to eradicate all of them, but you want to control them. Decline in chronic diseases. That's, again, your health behaviors, lifestyle changes that you want people to make. Safer, healthier foods. FDA is a big one there. Healthier mothers and babies, so maternal child health. Making sure we have safe deliveries in hospitals, and different things like that. And if people choose not to be in a hospital, which is a choice, that they have access, though, and that it is a choice versus a lack of access. Family planning, birth control. I didn't mention it earlier, birth control was in the 1900s. Birth control pill. There's always been, some forms of condoms and different things. And if you take some of my sexual health classes, we'll talk about those in detail. Fluoride in drinking water. Fluoride is very important for your teeth, and if you're not getting fluoride then in your drinking water, which was an issue in even the mid 1900s, late 1900s, and it can still be depending if people are on well water now, but now we have medicines that you could take, pills, tablets. I know when I was a kid I had to take them because we had a well water that didn't have a lot of fluoride, and all of a sudden my brother, my sister, and I were all getting tons and tons of cavities. So we started taking fluoride tablets to help prevent cavities. In the 1900s, we also really realized we recognized that tobacco use is a health hazard, and it was causing lung disease and other issues. Okay, so what are big things? So there are approximately 40 diseases unknown even a generation ago. So these diseases are still popping up. Sometimes it's a matter of, have they been popping up and we didn't recognize them as a new disease, or are they things that we thought were something else? Different things. WHO verified more than 1,100 epidemic events in the past 5 years. So from 2002 through 2007. Infectious diseases that have been persistent for thousands of years still pose a threat. Okay, so some of these diseases are still around and they still can cause major issues. Okay, so in conclusion, look over what global health is, understand the evolution through the centuries. Okay, know, things that they invented in the 1700s or 1800s we're still using. Some of the health concerns are still the same, some of them have passed. Understand what health professionals, what all they do. Okay. Again, health education, this was a lot from last week. Think about poverty and how global cooperation affects everything. And what is the role of the health educators in doing that? As always, if you have any questions, please let me know. Make sure you read your textbook. If you do not have your textbook for whatever reason, I need you to please get in touch with me. Have a great week.